an appointment today for... Can you go ahead and confirm your first name for me?
Kasey.
How do you spell that?
Kasey.
Okay, perfect. And your date of birth?
January 9th of 2000.
2000. Okay, that's perfect. So what brings you in today?
I've been having a migraine for like the past month.
Okay.
It's been in and out and like fluctuates, but I'm not sure what's been causing it, and it doesn't go away.
Okay. Do you have a history of migraines, or is this the first time?
This is the first time.
Okay. So you still have like it goes away, it comes back. How many migraines have you had in the past month?
In the past month, I think it's been pretty much like 5 times.
Okay.
So like once or more a week.
Okay.
And I can't concentrate.
Yeah, it's really hard. I sometimes get migraines myself too, so I can totally relate. Just gonna confirm what kind of symptoms you get when you have migraines. Do you ever smell smoke or something? Some smell that you know it's not there?
Yeah, it's like, it's weird. I start smelling random, like things that I don't normally smell.
Okay. And then, how's your vision? Does your vision get blurry?
When it gets really bad, it starts to get blurry.
Okay. How about the pain? Where would you say, is it localized somewhere, or is it just like all over?
I feel like it's localized in the front area.
Front area. Okay. Have you been having any other symptoms at all?
Outside of that, there's been like abdominal pain, and I don't know if it's related or not.
Okay.
But it kind of happened around the same time.
How would you rate the pain on a scale from 1 to 10?
I would say about 7 or 8.
7 or 8. So that's pretty bad. Is it constant or goes away, comes
It's
back?
the same as the migraine. It comes and it goes. It's mostly when I wake up that I start to feel it.
In the morning. Okay, I'm going to get a little bit of your history as well. When was your last menstrual period?
I believe it was the actual 5th of this month. Okay. So I'm currently on it.
Okay. That's very good. Do you have any history of chronic illnesses, any heart disease, or how about in your family? Is there any history of diabetes, heart disease?
Yes.
Which one?
Excuse me, diabetes.
Diabetes, okay. Okay, so I'm going to get started with your vital signs, okay?
Absolutely.
Okay, I'm going to be placing this on your finger. You can go ahead and rest your hand. And I'm going to take your blood pressure. Just put it up there. Go ahead and uncross your legs for me, please. take your temperature as well. It's going to go under your tongue. Close. Just takes a second. Okay. That's 99.1. That is normal. Okay, so temperature is normal. Your oxygen 97, heart rate 90. Heart rate's a little bit elevated for resting position. Do you know if that's normal for you?
Not normally.
Okay. So I'll definitely listen to your heart. Okay. Just breathe normally. Okay, I can hear only S1 and S2. Now it's 3, now it's 4. No extra sounds. Definitely no signs of murmurs. And I'm going to listen to your lungs. You can go ahead and take a deep breath. Exhale. Take a deep breath. Exhale. To your back as well. Take a deep breath. Exhale. Take a deep breath. Exhale. Okay. That all sounds very normal as well. There's no wheezing. So that's great. Okay, I'm going to be putting my gloves on and I'm going to start palpating your head. Okay, I'm gonna start palpating your head. I just want to make sure there's nothing superficially, no lumps, no masses. Just go ahead and relax. Okay. Mastoid bone seems to be normal. I cannot feel any lumps. Palpating your face. It's looking pretty soiling. Is there any pain right now? No. Okay. Okay, I'm going to walk behind you and I'm going to palpate your lymph nodes. Okay. doesn't feel swollen. Submandibular. Okay. Pre and post auricular lymph nodes. Not enlarged. Okay. Checking for any swelling in your clavicle. Can you shrug your shoulders for me? Is there any pain here?
Just a slight pain back here.
Back here.
Right by my spine.
Have you had this for a while?
I think about 2 months.
Okay, I'm gonna check your abdomen first to rule out any relation between your cramping and the migraines. And then I'm gonna take a look at your back as well. Okay, Kasey, I'm gonna start palpating a little bit. Do you mind if I fold this down a tiny bit? Okay. So when you get the pain, is it localized in a certain area of your abdomen?
Yes, it's like at the lower left. Yes,
Kind of like here.
absolutely.
Okay. Just gonna first take a visual inspection of your abdomen. Taking a look at your skin, making sure there are no scars. I do notice a tiny scar here above your belly button. Have you had any surgeries?
No. My mom said that was a birthmark.
Oh, okay.
Something went wrong with the umbilical cord at birth. I'm not sure.
Okay. But it has never caused any pain or issues?
Not that I know of.
Okay, very good. Okay. So other than that, the skin looks normal color. I don't notice any discoloration. There's no swelling, which is good news. So I'm just going to start lightly palpating. I want to first just making sure there's no tenderness anywhere. Would you say there is pain right now or not?
It's slight pain.
Slight pain, okay. So I'm not going to be pressing too hard on this area, and I'm just going to leave that until the end, just to avoid any major discomfort. Okay.
Absolutely.
So I'm going to start by trying to locate some of your major organs. Okay. Try to find your kidney here in this area. Sometimes it just hides. any swelling. That's good. Trying to find your bladder here. Is there any pain?
No.
Would you say your bladder is full right now?
No.
No, really? Okay. So yeah, it's definitely normal size. That's very good. Okay. Palpate over here. Now try to find your liver. Making sure there's no liver inflammation here. Is there any pain? Okay. Liver is normal size as well. Smooth edges, which is always a good sign. I'm going to try to find the spleen over here. Okay, yeah, it's definitely hiding. There it is. It's almost here behind your left thoracic area. Okay, again, that's normal size. No swelling. It's done. Okay, and lastly, I'm just going to palpate this area where the pain is. Just a little bit of tightness. And I definitely think this is related to inflamed ovary, your left side. It's definitely not the kidneys. So there shouldn't be any relation between your cramping and the migraines.
Okay.
I would recommend that you visit your gynecologist to follow up on that. Okay, I'm just going to listen to your abdomen. Okay, definitely I can hear normal sounds on your abdomen. I'm going to be tapping lightly. I just want to listen to the organs. temperature organs seem to be normal.
Okay.
I would definitely have you follow up with your gynecologist about your cramping.
Okay, absolutely.
Can you go ahead and sit on the bed facing the wall, please? Okay, Casey, I'm going to put your hair up just to have better access to your back. Is that comfortable?
Yes.
Okay. Not a very good. Here, I'll try again. Okay, a little bit better. Is that comfortable?
Yes.
Okay. I'm just taking a look here at your back. While we were doing that test where you were shrugging your shoulders, it hurt
Yes.
a little bit towards the back. Was it this area right here?
Yes.
So definitely I feel a lot of tension. It's even a little bit swollen on this side. You say this pain started about 2 months ago?
Yes.
Was there anything that you can pinpoint that happened?
Not necessarily. I do think maybe I strained it working out.
Okay.
But, I shouldn't have Googled, but I Googled. And it said it should go away, but it has not gone away.
Okay. So yeah, it's definitely a little bit inflamed, but it just seems to be muscular, so it is possible that you could have injured it while working out. And sometimes that can even start causing migraines.
Oh, wow.
There's a lot of tension in this area, so that definitely could be related.
That makes sense.
Making sure that your spine is not misaligned. Take a couple of measurements. Just want to make sure that spine is symmetrical. So your left shoulder is a little bit higher than the right, and this area is definitely very, very tight. I'm going to do a little bit of point pressure therapy, but that will help start releasing some of this tension, but I definitely recommend you go to a chiropractor for a full body adjustment. I'm going to be applying pressure evenly on both sides, just making sure that we work on it symmetrically. Go ahead and tell me if you feel this on your left, your right, or both sides.
Right, left, both, right, left, both, right, left, right, left, right, both.
Okay, so it's definitely normal. Would you say this feels the same as this?
No.
Okay, so this is more of a sharp sensation?
Yeah.
This is more like dull?
Dull, yes.
Okay. Can you tell me how this feels?
Sharp, dull, sharp, sharp, dull, 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 sharp, 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 dull.
Okay, very good. So there's definitely no issues there.
Okay.
I do want to do a few tests to make sure that your migraine symptoms are indeed just related to the migraine and there's nothing else wrong neurological. So you can go ahead and face me, please. Okay, Kasey, I'm going to start just taking a look inside your ears. Look here at your tympanic membrane, and everything seems normal. There's no excess of wax buildup. a healthy amount. No signs of inflammation. So that is great. And over here, same thing. Tympanic membrane is pearl gray. No irritation or redness. Very good. Okay, so I'm going to ask you to close your eyes. And I'm going to be doing a hearing test. Okay. Can you hear that? Yes. Would you say that that is louder or this one? That one's loud. Okay. This is louder or softer? This one louder. Louder, okay, perfect. Tell me when you stop hearing it. Stop. You can hear that? Yeah. Just tell me when it stops. Stop. Can you hear that? Yes. Perfect. Can you hear this symmetrically on both ears? No. Where do you hear it? Nowhere. You don't hear it? Okay. Let's try that again. It was a little bit too. Yes. You hear it on both? Yes. Okay. Very good. Okay, so I'm going to be making a sound on either one of your ears, and I just want you to tell me which one sounds louder. Does this sound louder or this one? The first one. First one. Does this sound louder or this one? The second one. About this one or this one? The second one. Okay. This one or this one? First one. Okay. This one or this one? The second one. Okay. Do you hear this on your right or your left? Left. Right or left? Right. Right. Front. Above my head. Okay. Left. Okay, that was very good. Okay, we're going to be taking a look at your pupils. Okay, definitely consensual, round, and reactive to light, so that is great. You can go ahead and grab this with your right hand and cover your left eye with your other hand. Yep. And how does that look? Can you read all the rows? Yes. Yeah. Can you read this one for me? L, T, F, P, H. Okay, do you know what color this is? Red. And this one? Green. What number is this one? 9. And this one? 2. Which circle is bigger? 9. Okay, very good. Can you go ahead and switch sides? It's a little bit blurrier, but I can still see. Okay. Can you read this one, or is that too hard? L, T, E, P, H. Okay, so definitely a little bit harder. How about this one? C, F, D, H, J. Okay, so that's good. What color is this one? Red. And this one here? Green. What number is that one? 8. Okay. And this one? 9. Okay, very good. Do you know what letter is this one? E. And this one? J. This one? T. Okay, very good. So vision is 20/25 on your right eye. Okay. Your left eye, sorry, your right eye is 20/20. Do you wear contacts or glasses? No. No? Okay. No. Okay, go ahead and close your eyes and you take a deep breath. You recognize that? Like coffee. Coffee, yes. Yes. Okay. And can you take a deep breath now?
Orange.
Yeah, very good. Okay, now I'm going to give you something to taste. Go ahead and open your mouth.
Cinnamon.
Cinnamon. Next, we're going to do a second one.
Tastes like sage. Very herby.
Herby. Okay, very good. Okay, so I'm just gonna do, before we go, a sensations test on your face. Can you go ahead and give me a big smile? Okay, I'm just trying to check your muscle tone for any muscle wasting. Go ahead and frown for me. Okay, can you frown your eyebrows as well? You keep them frowned. I'm going to try to lift them up. Just don't let me. Okay, very good. Now can you raise your eyebrows? Very good. I'm going to try to pull down. Okay, that's perfect. And can you stick your tongue out? Lift it up. Okay, so that's normal, definitely. Oh my God, my cold is farting so much. Okay. So I'm going to be checking sensations on your face. We're going to do a similar thing than we did with the sharper dull. Okay, can you go ahead and close your eyes?
Sure.
How does that feel?
Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. 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 Sharp. Sharp. Dull. Sharp. Sharp. Sharp.
Okay, that's very good. Tell me if you feel this on your right or your left or both.
Both. Left. Right. Left. Middle.
Okay.
Both. Middle. Both. Left. Right. Both. Middle. Both. Right. Both.
Okay, very good. Okay, Kasey, I'm just going to make note of that here. So it definitely seems like your symptoms of smelling smokers, smells that are not there, are not related to a cranial nerve issues. So it's definitely just part of the migraine episodes, which is very common. The blurry vision, you do have 20/25 vision on one of your eyes, but I think that when you start seeing blurry during a migraine episode, that's very normal. So you can definitely follow up with your optometrist and just get checked. It's possible that you might need a little bit of help on your left eye, but it's definitely not impeding you from living your normal life. And the abdominal pain was definitely not related. It does seem like an issue with one of your ovaries. So definitely follow up on that with your gynecologist, okay?
Absolutely.
Do you have any questions?
I don't think so.
Okay. So the other thing I do recommend is visit a chiropractor and start working on your it was the left shoulder, and that's definitely going to help with the migraines. But if it doesn't, definitely come back and see me, and I am going to give you a prescription in the meantime to help you manage the pain when you're having migraines. Okay, very good.